In this video, I'll uncover the most important signs that you need to look for to determine whether or not your pancreas is in trouble. Many people are familiar with systems in the body, such as the cardiovascular system. You know what the heart does. You know what the liver does. There's probably a good chance you're familiar with the gallbladder and some of its processes as well. But there's a certain gland that not too many people are familiar with, and that is the pancreas. And the pancreas really plays an incredible role in your overall health, and there's sufficient evidence to show that many people are struggling with their pancreas health. So that's why in this video, we're going to talk about the signs your pancreas is in trouble and how to heal it naturally. As I said, many people are struggling with these issues, so stick around to the end of this video. But before we get started, I'm Dr. Zyrowski, and welcome to the channel. If you're new to the channel, it is a pleasure to have you here. Be sure to subscribe, hit the bell notification, and also be sure to join our notification community. That way it can help you excel your health and your life. So let's go ahead and kind of break down what the pancreas is, because we want to talk about the top signs as to whether or not you have some issues with your pancreas. But what is this whole thing with the pancreas? What is it? What does it do? So the pancreas is a gland, and it's about 6 inches long, and it's located behind and below the stomach. So in this picture, you see it right here, right out front. But in reality, we would see the stomach covering it up. And so it's below and behind the stomach. Now, it's part of the small intestines, and it plays a huge role in your overall health. There's two major things that it's going to do for your overall bodily functions. One is going to function as part of the exocrine system. And as part of the exocrine system, what it's going to do is secrete enzymes into the digestive tract. So you eat some food, it's going to help secrete some of those enzymes, those pancreatic juices as they're referred to as, and as a result, you're going to be able to digest your food. It's going to release enzymes such as lipase, which is going to help you break down fat, or amylase, which is going to help you break down carbohydrates. And there's even some enzymes released that help you break down protein from the pancreas. And so it plays an incredible role in your digestion. Now imagine if your pancreas isn't functioning right, which a lot of people have this issue. And think about the things that will happen. Well, you won't get proper enzymes. As a result, you won't be able to digest your food properly. You get a lot of gas, a lot of bloating, a lot of issues will come out of it. And you can start to think about all the people who are actually having these particular issues. Now, it's also part of the endocrine system, and what it's going to do there is it's going to secrete insulin, which is a hormone that's responsible for taking the sugar from the bloodstream and putting it into the cell. So let's say you eat some high sugar foods, your blood sugar just doesn't go through the roof until you die in shock. Essentially, your body is going to have the pancreas release some of that insulin. It's going to take that sugar and shuttle it into the cell. And then it'll even help store it so that, once again, you don't go into some sort of shock. And it also secretes a hormone called glucagon. Now, this is going to do the opposite. So the insulin is going to help bring your blood sugar down, but the glucagon is going to help bring your blood sugar up. Let's say that your blood sugar is very low. The glucagon will be released. It will help break down the glycogen stores in the liver, help bring your blood sugar up to a very stable level versus you just dropping to a level that's very dangerous. And so we can also imagine if this whole process and this whole function isn't working correctly in the body, somebody's going to have a rough road, right? We're thinking type 2 diabetes. We're thinking people have insulin resistance. They're not getting proper secretion from the pancreas with the insulin. And then there's even the people who have the problem where they're going from hyperglycemic to hypoglycemic. They're kind of all over the place. Once again, this issue with the pancreas can cause a lot of problems for us. Let's go ahead and talk about the issue of fatty pancreas, okay? Because this is an issue that not too many people are talking about. We hear about fatty liver all the time, but we don't really hear about the fatty pancreas. Now, fatty pancreas is a big deal because if we have 80 to 100 million people suffering from fatty liver, and then from there, there's a good chance if you have fatty liver that you also have fatty pancreas, then it's something that we should really consider. And let's talk about one of these studies I looked at. It was published in the Journal of Environmental Health and Preventive Medicine, and what they did is they took 9,933 subjects that they studied in Japan. What they had found is that fat accumulation in the pancreas is a significant risk factor for chronic pancreatitis, okay? Because the whole thing was, well, is fatty liver a big issue? Well, yes, we know now that that is an issue because it can actually lead to severe liver degeneration. And then the question becomes, well, is fatty pancreas a big liver? Well, what we have found is if the pancreas is fatty, then as a result, it leads to pancreatitis, which may lead to pancreatic cancer in the future. Okay, so that's a big deal. Once again, when this gland is highly inflamed, it can't function as it's supposed to. We're talking insulin resistance, as I mentioned. We're also talking about type 2 diabetes. We're talking about any type of diabetic who has a problem with their pancreas because it's not functioning correctly. If so many people are suffering from fatty liver, we can also draw the conclusion, because it's hard to know the different numbers out there, we can draw the conclusion that many people are suffering from the issue of fatty pancreas as well, because of the poor quality diets that people are eating. Now, when we look at one of the top things that stores fat deposits in the liver and in the pancreas, we're going to look at something like high fructose corn syrup. This is very, very inflammatory, and it's highly, highly prone to causing your liver and pancreas to have fat deposits within it. Let's go ahead and talk about a little bit further about pancreatitis, because we had mentioned that if you have this fatty pancreas issue, it leads to pancreatitis. So one of the top signs is going to be middle left upper abdomen pain. When we think about this, it's going to be middle left upper abdomen right here. So a lot of people will get pain right in here, and sometimes this pain can actually go and radiate round to the back. Okay, a lot of people will misunderstand this for some spinal pain, but in fact it's actually pancreatitis. And so if you're getting this issue right here combined with some of these other factors, some of these risk factors, so you're eating a poor quality diet, you have insulin resistance, you have fatty liver, then you might want to take this very seriously. Indigestion is also another symptom. Nausea and vomiting, abdominal tenderness, unintentional weight loss. So if you're losing weight and you have some of these other things that we're talking about going on, you want to take this seriously. Decreased cognitive function, bloating and distension. Remember, it goes and releases these enzymes. The pancreas is releasing these enzymes when it's not functioning correctly because you have pancreatitis. Then it leads to bloating and distension, and then fever as well. Okay, so we have to take these different signs very seriously, because in an acute stage of pancreatitis, it can be something you can reverse. Once you start getting into the chronic stage of pancreatitis, it can be very, very devastating to your overall health, because you can go and create irreversible damage, and that's not something that you want to have. Let's talk about some of the reasons this is happening, okay? First of all, I want to mention gallbladder. One of the major reasons that people get acute pancreatitis is because of gallstones and gallbladder dysfunction. As a matter of fact, it's estimated that over 275,000 people a year are admitted to the hospital with pancreatitis. One of the top reasons is going to be gallstones and gallbladder dysfunction. But of course, we just look at how did we get there in the first place? With this fatty pancreas and, the gallbladder problem and fatty liver. Well, first of all, it's going to be lifestyle, okay? So we want to make sure that we're removing grains. This is very important. We don't want to be eating grains, which are highly inflammatory at this time. And we also don't want to be eating all these carbohydrates that are also going to raise up our blood sugar. It's very important at this time that we drop our blood sugar down as we're trying to reverse inflammation and work on reversing this problem with the pancreas. We also want to remove sugar. As I mentioned, one of the worst ones is going to be high fructose corn syrup, but of course, all sugar in general should be avoided at this time. If we want to fix this issue, we have to go in and remove sugar. Very important. And we also want to remove processed foods. Okay, these processed foods, first of all, are going to have a lot of the high fructose corn syrup in it, but it's also going to have all these different artificial ingredients, highly inflammatory, and likely to just make this problem worse. Okay, we have to clean up our lifestyle. That's what I'm saying here. We have to clean up our diet. So important. Now, nutritionally, there's a couple other things we can do. We can add in things like N-acetylcysteine. This is very powerful for slowing down and reversing that inflammatory problem there, but it also is very good at boosting glutathione, one of the most powerful antioxidants in the body. So N-acetylcysteine is great for this problem. Selenium, milk thistle, and alpha-lipoic acid. These are all very good. Now, if you go and you just do the nutrients here without the lifestyle, you'll get some decent results, but you're not going to get great results. If you go and do the lifestyle without the nutrients, you'll also get some pretty good results, but you'll get faster results when you add in the nutrients, okay? What I'll do is I'll put a link in the description below to different compound that we use called Liver Assist. Clinically, we use this in order to help with these issues. What you're seeing here is that the same nutrients that help with fatty liver, that help with gallbladder issues, are also the same ones that help with the pancreas as well. Because guess what? It's all connected. They all function together. And so when one has a problem, the other has a problem. And so we can utilize these different things in order to help our pancreas drop down the inflammation and get the pancreas functioning well so we can reverse problems like insulin resistance, type 2 diabetes, and we also can fix a lot of stomach issues that many people are facing as well. Give this video a thumbs up, share it with your friends, put in the comment section below if you've ever heard of somebody having this issue. I'd like to know how many people you're aware of that have had this problem, and then watch this video on how to fix gallbladder health as well.
You may be having some different symptoms, and in fact, it could be your gallbladder that's causing them, and this information can really benefit you.